All right, today we're going to dive into a rare but really significant condition that happens at birth called bladder exstrophy. Now, it sounds complex, and it is, but if we break it down, it gives us this incredible window into the amazing journey of human development.
So, let's kick things off with the big question that's going to guide us through this whole explainer. How on earth can a tiny error, happening just weeks into development, cause an internal organ to actually form on the outside of the body? It seems impossible, right? Well, the answer is in this fascinating and very precise chain of events that happens long before we're born.
Here's the game plan for today. First, we'll nail down exactly what this defect is. Then we'll see it's not just one thing, but part of a whole spectrum. After that, we'll trace it all back to a single tiny mishap in the embryo. We'll cover the clinical signs doctors look for, and then we'll get to the incredible surgical solutions.
Okay, first things first. Before we go any further, let's get a really clear handle on what we're actually talking about here. What exactly is bladder exstrophy?
So, at its very core, bladder exstrophy is a structural problem that's there from birth. Just try to picture this. The lower part of the abdominal wall and the front of the bladder, they just don't fuse together. They fail to close. This leaves the bladder's inner lining completely open and exposed to the outside world. It's essentially turned inside out. Now, here's a really key idea to wrap your head around. Bladder exstrophy doesn't just happen in isolation. It's actually part of a bigger family of related developmental issues. Let's take a look at what that means.
That family has a name, the exstrophy epispadias complex. The best way to think about it is like a spectrum, ranging from pretty mild to much more severe. And classic bladder exstrophy, the one we're focusing on, sits right there in the middle. It's the most common form you'll see. So here's how that spectrum lays out. On the mildest end, you've got epispadias. This only affects the urethra, which is the tube that urine passes through. Then, in the middle, you have classic bladder exstrophy. And then, at the most severe end of the spectrum, is something called cloacal exstrophy. And this is where both the bladder and the bowel are involved.
Okay, so we've got the what down. But what about the why? I mean, what actually goes wrong so early in development to cause something like this? The answer is pretty amazing, and it takes us right back to the first few weeks of life in the womb. The root cause, the single event, is the premature rupture of a temporary structure called the cloacal membrane. Think of this membrane as a kind of biological zipper. It's meant to hold the lower abdomen closed while all the muscles and skin form over top of it. But if that zipper breaks open too early, well, the walls simply can't finish closing. And with this, timing is literally everything. Before the 7-week mark of gestation, there's a wall forming called the urorectal septum that's busy separating what will become the bladder from what will become the bowel. Right at 7 weeks, that separation becomes complete. This moment, this 7-week mark, is absolutely critical. And here's why that timing matters so much. If that membrane, that zipper, ruptures before the 7-week mark, when the bladder and bowel are still a single unit, the defect hits both systems, and that leads to the most severe form, cloacal exstrophy. But if that rupture happens after 7 weeks, once they've already separated, the defect is confined to just the urinary tract, and that's what causes either classic bladder exstrophy or the milder epispadias. It's just one event, but its timing determines the entire outcome. Okay, so now we understand the cause, this early developmental hiccup. So let's talk about the effect. What does this actually look like? What are the physical signs that doctors and parents see in a newborn with classic bladder exstrophy? Well, the most striking sign, the one you can't miss, is the exposed bladder plate right on the lower abdomen. And because it's wide open, there's a constant leaking of urine from the 2 little openings where the ureters connect. You'll also see that the abdominal muscles are widely separated, and sometimes there's an umbilical hernia as well. The issue also runs a bit deeper, affecting the skeleton and genitalia. The pubic bones, which are supposed to meet in the front of the pelvis, are spread far apart. For boys, epispadias, that urethral defect we mentioned, is always part of the picture. And for girls, it's very common to see a split or bifid clitoris. Now, beyond all the immediate structural problems, there is a major long-term concern. That constant exposure of the delicate bladder lining leads to chronic inflammation. And over many years, this carries a higher risk of developing a specific type of cancer called adenocarcinoma. This really drives home why surgery isn't optional. It's absolutely essential for long-term health. And that brings us to the most hopeful part of our story today, the path to repair. Thanks to some absolutely incredible advances in pediatric surgery, we have really effective ways to reconstruct what didn't get a chance to form correctly in the first place.
When it comes to the surgery, there are basically two main philosophies. The first is a staged repair, which is a carefully planned series of operations that happen over the first few years of a child's life. The other approach is a single-stage complete repair, where the goal is to fix everything in one big, comprehensive operation right after birth.
Let's take a closer look at this staged approach because it's quite common. The whole journey starts almost immediately. Within the first 72 hours of life, surgeons perform the first operation to close the bladder and the abdomen. Then, around 1 to 1.5 years old, comes the second surgery to repair the urethra. And finally, around age 4, the last stage focuses on reconstructing the bladder neck to give the child control over urination. The goal here is so much more than just closing a hole. It's about creating a fully functional urinary system that works. It's about achieving continence, protecting the kidneys from any long-term damage, and giving that child genitalia that are both functional and look normal. It's really all about ensuring long-term health and, just as importantly, quality of life.